8:16, Tommy Tucker, WWL, bringing us back with some Rush. Dr. B, Dr. Brent Wallis joins us from People's Health. Dr. B, you a big Rush fan or not?
Not so much.
Tim, don't ever play that song again, especially when Dr. B is coming on. Chief Medical Officer for People's Health. It is Men's Health Month, so Dr. B from People's Health is going to talk about some important issues that affect men's health. Is it true that most men don't go to the doctor? I think I know the answer to this.
Yeah, it is. It's unfortunately absolutely true. Just ask my wife. And, there's been a lot of studies done on it. Cleveland Clinic did one of the bigger ones with over 1,000 men and really confirmed that only about half get regular checkups. And they even found that about 3/4 of those men would rather clean the bathroom than go see their doctor. So very unfortunate. I tell people all the time, though, really the best way to manage your health and maintain your health is to get those regular checkups so that we can test and screen you for any conditions that you might have. So it's really important to go see your doctor regularly.
You like to think you're unique, but first of all, I would rather, the least tasteful task to me in cleaning a house, which I hate, is the bathroom, and I would pick the bathroom rather than going to the doctor. So I'm not unique at all. What are the top health risks for men, Doc?
Yeah, absolutely. Number one is heart disease, and most people know this, but, over half of adult males have some form of cardiovascular disease, and that can be congestive heart failure or heart arrhythmias. It's just very, very common and very important to identify as early as possible. Stroke is another huge risk, especially as you get older. The interesting thing about strokes is about 80% of them can be completely prevented just through lifestyle changes, not even through medications or anything. And then the other one people don't think about is really depression and suicide. And, men are 4 times more likely to commit suicide than women. And, those rates have actually increased. Men are less likely to seek care for depression, and so it can progress and get worse. And suicide, unfortunately, is the 10th leading cause of death in the United States. And there's a lot of reasons for that, social isolation, really lack of mental health treatment options, and then a lot of problems with drug and alcohol abuse all add to that. So, again, that's why it's really important if something's going wrong and you're not feeling well, you need to definitely go see your doctor.
Cancer, another big concern?
Yeah, cancer is a huge concern as well, especially as we get older. And, there's kind of the big 3 for men. It's lung, prostate, and colon are the biggest cancers. And lung cancer, unfortunately, those rates are rising. And it's really unfortunate. I can't say it enough. It's completely related to smoking. And so if you haven't quit already, now is the time to quit. Prostate is probably the best known type of cancer in men that you think about. It is the most common cancer in men and the second leading cause of death. So probably about 1 in 9 men will be diagnosed with prostate cancer at some point in their life, and about 1 in 40 men will actually die from it. So, there's a lot of debate over screening for prostate cancer and how that gets done. So I usually tell people to talk to your doctor, especially if you're 50 or older, to talk to them about, what needs to be looked for to determine if you may have prostate cancer. Family history plays into it as well, and it's very treatable if you catch it early. And then the last one is colon cancer. And, here's the thing about colon cancer. It is highly detectable and completely preventable if you identify it early enough. So it is critical, very, very critical to get screened for colon cancer. And really the screening modalities can be pretty easy. People are very concerned often about colonoscopy. They don't want to get that done, but there are other ways we can screen for colon cancer. So make sure you talk to your doctor about what those what those risks are and what the screening options are. And keep in mind that we actually recently lowered the screening age for colon cancer from 50 down to 45. So a whole lot more people need to get screened that haven't done that yet.
All right, we'll take a break. I will add doctor because I'm not ashamed of this at all. I've suffered with depression most of my adult life. And for guys that hate to go to the doctor like me, it's no different. There's no shame attached to it. It's no different than having going to see an orthopedist because you hurt your elbow playing touch football or whatever. Your brain is broken, and it needs to to be treated, and I'm not ashamed of it, and I suffer with depression, and if you are suffering with depression, please see somebody, and there's nothing to be ashamed of. It's Men's Health Month. When we come back, we'll talk about other types of screenings that are important for men as we continue our conversation with Dr. Brent Wallis, Dr. B, our friend, Chief Medical Officer of People's Health, 821 Traffic Now, WWL. Tommy Tucker, WWL 825, back with our friend, Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, and we're talking about Men's Health Month. And Men's Health Month, yeah, that's right. And we were talking about cancer screenings, but there are some other screenings, Doc, that are, and a quick note about Chadwick Boseman, that actor from Black Panther lost his battle with colon cancer at age 43, so it is really nothing to fool around with at all. Aside from cancer screenings, what are some of the other types that are important for men to go through?
Yeah, sure. And Tommy, thanks for saying what you said before the break about depression. It is a medical illness, and it's one that we can screen for. Often we'll use, there's a patient health questionnaire that just has 2 questions that can help screen for depression, so answer those truthfully. The big things we do screen for, though, at many of the visits you have with your doctor, cholesterol is a big one. Cholesterol, when high, can lead to heart disease and stroke, and every man over 35 should get checked at least every 5 years. And as you get older, once you're 50, or if you have high blood pressure or diabetes, you'll be checked every year to keep that under control. And then blood pressure is critical. We talk about that a lot, but we check your blood pressure every time you come into the doctor because it's so important to reduce your risk of a lot of different illnesses, in particular heart disease again. So that's going to be checked when you come in. We, almost always weigh you when you come in as well, and we do that to calculate a body mass index. The higher that is, the more risk it confers for a lot of diseases. In particular, diabetes can be a big problem with elevated weight, as we know. And then another one related to diabetes is a test called an A1C. And an A1C is really measuring your average blood sugars over the past 3 months. We use that to diagnose either prediabetes or diabetes itself, and then we use it to manage diabetes if you've been diagnosed. So it's real important around age 40 or 45 to get a baseline A1C to see if you may have a problem with your sugar.
So what are some of the things we men can do to improve our health during this month? Well,
so the number one, I can't say it enough.
Let's say next month. We only have a day left to this month,
yeah,
but in the
true.
future. So
in July, make an appointment with your doctor for sure, for all of these preventative screenings and let them know what's going on with you. But, but beyond that, there's a lot of little things you can do in everyday life. It's important to get enough sleep. We don't put enough emphasis on that, but sleep is when your body repairs itself. So 7 to 9 hours per night is really necessary if you can make that happen. And I'll say it again, toss out the tobacco. You've got to stop smoking if you're smoking because it's just linked to so many types of diseases, both medical and cancer-related diagnoses. And then move more, exercise. We always recommend about 2.5 hours of moderate intensity exercise every week if you can get that in. Walk around the neighborhood, take your dog for a walk, go swimming. It's hot. Get in the water. That's very important, and that'll help your heart health. And then really try to get a handle on stress. Take breaks in your day, take breaks from kind of the constant news cycle. Do something you really enjoy doing and try to lower your stress level because that's going to help your health overall. And then diet. We do not emphasize this enough, but diet is critical. It really controls our health. So you've got to make sure you're including vegetables, green leafy foods, reduce the number of calories and really the sugar and salt that you're taking in, because ultimately those are all going to lead to more health problems in the future.
Is it true, bad news, Bubba, when you get older you can't eat as much and you can't eat like you used to when you were younger? It's just a fact. Deal with it?
Yeah, usually so for most people. So you have to adjust that as you get older for sure.
And I guess the body, in terms of exercise, can't sustain maybe the running that you used to do when you were younger, so you can't burn it off, and you just have to just kind of suck it up, buttercup, right?
Yeah, you've got to adjust as you get older, but definitely keep moving and keep eating right, because that's ultimately going to keep you going for much longer.
Doc, I got a question about congestive heart failure that I think is an important one, so I'll ask you when we come back from the news. We'll talk a little bit more about people's health as well. Dr. B is our guest, Dr. Brent Wallis, Chief Medical Officer at People's Health, the 5-Star People's Health Network, and we'll wrap it up when we come back. 8:30, time for WWL First News. For that, we go to Dave Cohen. Thank you, folks. Quickly back to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Doctor, somebody texted in about congestive heart failure, and if you could kind of give us a little rundown on that. Is it like a heart attack where it happens quickly, or is this something that develops over time? How does it happen? How do you prevent it? How do you cure it?
Yeah, sure. So congestive heart failure, sounds like it's something that would happen suddenly, but typically that's not the case. It's usually related to longstanding high blood pressure. Sometimes it can be related to old heart attacks or decreased blood flow within your heart. But really what the hallmark is that your heart is not squeezing well enough to pump the blood where it needs to go. So, that's why it's so important to get screened by your physician, because you can't always tell that congestive heart failure is developing. One of the first signs can be a little bit of shortness of breath when you try to exercise. So very common condition and one that has to be taken very seriously.
Did you say very common?
Yeah, very common, unfortunately. Like I was saying earlier, about 50% of men, over the age of 50 have some form of heart disease, and congestive heart failure is one of those types.
And can it be treated easily or not?
Yeah, we definitely have a lot of ways we can treat it. Medications are really hallmarks, so taking certain medications that help your heart pump more efficiently can really decrease the symptoms and increase your survival, actually. And then the other one that is critical with congestive heart failure is diet. It's very sensitive to salt intake, so the more salt you take in, the worse your symptoms may get. So definitely one to watch for.
I'm going to tell people how to get all the information from People's Health in a second. Tell me about the 5 stars quickly, though, Doc, if you can, because that's some pretty special stuff.
Yeah, we're very excited about that. So, for this year, for 2022, we were rated as 5 stars in the CMS STAR program. And what that means is that we're being recognized for providing excellent quality to our members and great quality health care to those members as well, ensuring that they're getting all of the screening tests and closing all those health care gaps that they need to. So very excited that we have that for this year.
Thank you, Doc. Good talking to you, and stay cool.
All right. Thanks, Tommy. You too. Have a great 4th.
You too, sir. To find out more, you can go to peopleshealth.com. Find out more about People's Health. You can visit the People's Health United Healthcare Medicare Center at 3017 Vets in Metairie. That's right next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765, or you can follow People's Health on Facebook, Twitter, and Instagram. I'm Tommy Tucker, back in a flash with Jefferson Parish President Cynthia Lee Sheng here on WWL.